Okay, so now we're going to go to our posterior sickle scaler, the Nevi 4. This is a great instrument because it's got a nice curve to it. It's got a nice durable shank, so you can go up to heavy calculus. Actually, both of our sickle scalers can be light to heavy calculus, but remember, super gingivally only. The Nevi scaler is used, it's a double-ended paired, and we're going to use one working end, both cutting edges for the posterior teeth, for surfaces towards, and then we'd flip it for away. That's very similar to what you did with your 11-12 Explorer. So what we would do is you'd have to determine the correct working end first, and that's the same as how we've always done it. I can check it by looking at the terminal shank. If the terminal shank is parallel to the tooth that I'm checking it on, I'm at the distal of number 13, and that functional shank's over that tooth, this would be the correct working end. If I wanted to test it, I could flip it. That's clearly not the correct working end. See how that's wrapping around that tooth? That would be impossible to remove calculus because the face is 100% looking at the tooth. So once I know I have the correct working end, I would use the inner cutting edge for the distals, and I would roll quarter turn it to do the outer. I want to talk about inner and outer a little bit. When you're looking at your curette, you can see that it curves, and your two lateral sides, there's one lateral side that's closer to the handle, there's one lateral side that cutting edge is facing towards the floor. The one that's towards the floor is the outer. The one cutting edge that's closer to the handle is the inner. So if you want to remember a little rule, inner is always distal on posterior teeth, outer is all the other tooth surfaces, meaning facial, buccal, and mesial, and lingual and mesial. So it looks a little bit like this. I check this out, I know I've got the correct end, my lower shank's parallel, my functional shank's up and over. If I were to double check it, I go, yeah, that's the inner cutting edge, so you can confirm it that way. I would go to a tooth, I'm just going to do these two premolars right here. I got the correct cutting edge. Now remember, that's 90 degrees, it can't be at 90. I'd have to close it just to tuck up underneath that tissue a little bit to get under that calculus. And as I walk it, I have to remember to be closed. I don't want to get completely parallel to that tooth. That would be too open. And do a short working stroke. Now what's nice about this Nevi 4 and having a curve, you can take this out, quarter turn it on the opposite cutting edge. You can come across that facial because it's a nice curve and it does fit, and then you might have to readjust your hand. And now starting at this line angle, you would come down and get that mesial of that tooth, making sure that your angulation is at that 70 to 80 degrees to the tooth. This is 90, that's about 70 to 80. So now I can go to the next tooth. I'm gonna hit, there's my outer cutting edge. I'm just gonna jump over with my inner, and I'm gonna just repeat that process. Come out, quarter turn it. Now if you notice, I started most posterior and worked anteriorly. That's what we always do with all of our instruments. We're gonna start most posteriorly on the distal and work towards the anterior, going from distal, buccal, mesial, distal, buccal, mesial. So anywhere you are working, you can figure that correct cutting edge the same way. Is this the correct working end? Or is this the correct working end? It would be this one. And I can double check it by going, that cutting edge is closer to the handle, that's the inner, inner's distal, outer's for all other tooth surfaces. And you would do the same process here. And having to use your mirror if you were in doing the lower, if this is the correct working end for the surfaces away on the mandibular, this is a surface away on the mandibular, so you do not have to flip your working end, and you get to use this same working end and do the same technique. If you notice, my fulcrum is on the opposite side of the tooth. If I'm on the lingual, my fulcrum really wants to be on the buccal. Same thing, any sextant you're doing, determine the correct working end, and you're going to use one working end, both cutting edges.